talking about, again, this changing market, how you help consumers, spend wisely around healthcare, and how do you, give them a place where they can actually pay for their healthcare ahead of time and do so cost effectively is Paul Ketchel, CEO of MDSave. Oh, good morning.
Good morning.
Hey, good to have you on the program.
Yeah. Great conversation here.
Yeah. Great to have you join us. For the market that doesn't know you, and MDSave has been with the IHC, tell the audience a little bit more about MDSave, please.
Yeah, MDSave was we're a fully bundled healthcare marketplace, meaning that we partner directly with healthcare systems and provider groups, and we fully bundle episodes of healthcare into a clear, transparent price. And users can log onto our site and they can search by medical procedure, see a fully loaded price from each of the providers in the area. They can click on that provider and go ahead and purchase that procedure ahead of time. And by purchasing ahead of time, they save typically 40 to 60% more than they would using insurance if they're on a high deductible or paying out of pocket. And we're able to get those discounts from the providers because we're guaranteeing them zero bad debt, and we're paying them in 6 days or less with no claims to file. So we're taking away all that inefficiency in the system from claims processing, billing, and things, and paying up front. We're able to just give those savings directly to the consumer.
Yeah. So you're providing savings. You're also providing consumers with where to go. I mean, you're giving them a roadmap on providers that they can access for X procedure, X care, which I think is very important in today's market as well.
That's exactly right. It helps the consumer, even if you're not going to use MDSave on your purchase, it's a great free resource to still log on and see what should I really be paying and what could I get this service for in my geography, and which doctors are offering better values, and the user can see that up front and make a decision. And also it's important, I think, to see that for everyone who's out of pocket for various reasons with plan designs, you can see that you can get a fully loaded price. You can know what something costs you up front and make a real an informed decision instead of just having to wait for bills to show up 6 months after the fact.
Paul, when did you launch MDSave?
MDSave launched just about 3 years ago.
Okay.
And go ahead.
You were ahead of the curve. Congratulations.
Yeah, we spent a year. We watched a little bit early when we saw the change coming because we wanted to get major healthcare systems contracted. We knew that was going to take a period of time to work through that with those folks. So we started a little bit early, but and it's been the market's really received it great. In the last 3 years, we're now in 24 states. We're in 140 markets. I think we have 40 more healthcare systems we're onboarding in the next 90 days. So. It's really growing, and the consumer growth is, anywhere between 20 to 30% month over month. So people are starting to hear about it, and when they see the savings they can garnish, it's really starting to help patients access care at a better price.
Paul, are you venture-backed right now? Are you a venture-backed company?
We are. So we're backed. We have a venture partner, MTS Health Partners, out of New York that came in and backed us in last April.
Congratulations on that.
Yeah, Paul, it's Ron Bachman here. Tell our audience a little bit, how would you connect or relate to their existing health insurance plan and the discounts they might have through the network providers? How do they assure that, if they're doing price comparison and they got a price from you, that how they're going to figure out how does that compare to somebody who might be in network? Because if your folks are out of network, that might actually ultimately cost them more out of pocket, wouldn't it?
Well, no, not exactly. When you look at MDSave, everyone is transacting that purchase using an HSA card or a credit card or the paying out of pocket. So all of these rates are completely independent of the insurance plan. So if you log on to the site and look at a procedure, we'll show you a transparency component of what the average price you would pay for that procedure in your market is with a contracted adjustable applied, meaning that if you were in network with an insurance plan, you have a high deductible, this is most likely what your out-of-pocket would be in this range. And we typically are better than the insurance rates in network or out of network about 90% of the time. And so, and if you are concerned about your rates and you're shopping around, you should come take a look at MDSave. Then you should call your payer. You should call your provider, try to see with your plan what you might owe. That's a difficult process because they can't always tell you that. But
right.
This is really for seeing those prices up front. You can make a decision. But I'll give you an example on something common like an MRI. It's not uncommon with your insurance plan to pay somewhere between $1,800, $2,500 out as your responsibility for that MRI under your insurance. And in many markets, we have those MRIs between $400 to $500. Same providers.
Oh.
So,
what's the next evolution of your product? Is it, if you haven't already, are you going to ultimately maybe connect to the insurance companies so you could get their pricing as a comparison to, say, a bundled pricing? Because carriers aren't typically bundling, and I love the concept of being able to get sort of a one price, for a series of services.
Yeah, we think the same thing. We think bundling is very, very important because without it, you can see a transparent price, and there's lots of resources in transparency. But if you get one bill outside of that transparency, you could change that price you thought you were getting 30-40%. So we think, number one, you really have to bundle these things to give the consumer real value. And then the second thing, to the insurance companies, we're now in talks with several insurance carriers, not just about connecting to get their data, but also in assisting them to take a white-labeled version of our product for their own their own members, and bundling their fee schedules for them because they've had difficulty with that, and offering this out to their own high-deductible patients. So you could log in, potentially your Blue portal, for example, and
right.
see your in-network providers and what those costs are fully bundled.
That'd be great.
Paul, are you connecting with the emerging direct primary care providers out in the marketplace?
We do. I mean, our model has been traditionally we have sold to, as I mentioned, the major healthcare systems, and as we sell to them, we allow access to all of their owned and affiliated providers. As you know, many of those primary care providers today are owned by those same health systems.
Yep. What about the exchange market as a distribution? I mean, you seem to be a natural fit with, what private exchanges are trying to do to offer that complete experience and that healthcare access, solutions, like yours. Are you engaged in talking with the exchange marketplace right now?
We have, in fact, some of the exchanges we're talking to are through some of the large insurers that operate and own some of these exchanges now, and also some of the ACOs also. So I think that, what we really view MDSave as is we have this great consumer platform, but we view it really as it's a healthcare transaction platform for this next innovation in healthcare. And so there's a place for it to connect to exchanges. There's a place for the payers to use it. There's a place for the open marketplace. And also now we're starting to work with a lot of large self-insured employers and able to improve their benefit cost and the experience that their employees have under their plan designs.
Is there an opportunity, Paul, to partner with some of the HSA players that are really looking to establish themselves as a portal and offer more than just, their HSA services?
Yeah, I think there is. I think you have to be, I would say that's maybe a smaller pool because you're going to have to really find the innovative guys who are on the front of that, who are really sort of looking to expand outside of what I think has been the traditional HSA model. But, one thing we've done with our platform is a lot like an Amazon or, a lot of the large tech companies. Everything we've built is an open documented API that can be plugged into other operating portals as a whole or in pieces. And so it may be something where if you have an HSA portal and you have a lot of users, this is an added functionality where you can really add value to those members in certain areas and certain plan designs.
So, Paul, if I'm a large employee, if I'm even a mid-sized self-insured employer listening or a large employer listening, what's the business model for MDSave? And what's the cost for me? I mean, you don't have to get into specifics. Just what's the business model?
So with the large employer, we build a separate portal for them that's branded that their employees use. They log in and verify it. It includes, not only MDSave's network, but we may supplement with their own contracted networks and help them bundle that. And so in that model, there's a PMPM. It's a low PMPM in that area, and it depends on your size. And then the rest of it, depending on how the plans are set up, we do have a transaction fee that's built into each of our bundles. It's a small fee, but traditionally we need it to pay credit card processing fees and things like that if we're taking payments. So if we have a plan where they're wanting us to collect some of the patient responsibility or give that option, we'll have a transaction fee on those. But if it's a plan where the employer's fully paying, then there wouldn't be a transaction fee in that scenario.
So if I'm an individual and my employer isn't connected to you, there's no enterprise solution that they've integrated your program with their existing self-insured plan, what's the business model for me as an individual? Do I go on and get your information? Do I pay a fee for that? How do you allow individuals that might want to connect to what your service is?
Anyone in the country can go to MDSave.com. There's not a fee to use the service. Only we do, as I said, we do have a transaction fee that's built into the bundled purchase. So if you choose to purchase a procedure and you're getting those savings, then we have a small fee that comes out of that. But there's no fee to go on the site to use it. You don't have to subscribe, pay a membership, or anything like that.
Now are the providers paying to be a part of your network? Is that your business model?
That's correct. So we have a fee that's paid, a software licensing fee from the providers or the healthcare systems that use it. Right. That's correct.
Okay. So the listeners out there who might be interested in this, you mentioned you're in 24 states. Is there a particular area where you've got concentration of providers that would give a fairly full range of services if somebody starts to use your website?
Yeah, I mean, all through the Southeast, the majority of the Southwest, and now, we're really growing in the Northeast corridor, too. So I would say New York South, is where we're starting to grow a little bit up there. And then, we do have some coverage also in the Midwest, the Chicago area and things. We're expanding in 2016, and we have several things in pipeline and aren't there yet, but I think we'll be there in the next 4 months, is a lot of things in the West. But right now, the Southeast, all the way up, from the South to New York, you're pretty well covered.
I think you got a great market that you're tapping into here, because some of the concerns that at least I'm seeing around the country is the consolidation of providers, hospitals buying up physician practices, and their billing practices are changing. I know a number of people have told me, and again, have family experiences where a traditional office visit now is being billed by a hospital as a hospital outpatient, and they double or triple the charges for these things. So I think a lot of people don't understand what's happening to the provider services and costs out there, and you provide a great opportunity for people to really do some price shopping comparison, and maybe an alternative way to get these prices reversed back to more normal costs that are true office visits rather than something some big corporate hospital entity is charging.
Yeah, and part of the reason that's happening with the hospitals is as they're acquiring these practices, those practices are now being bound under the pre-negotiated contracts the hospitals had with their payers. And so in many cases, the hospitals, we're helping them because this is causing a lot of bad debt on their side because patients have these high deductibles and they can't pay these exuberant charges. And before we really came along, there wasn't a way contractually for the healthcare systems to really offer a discount, and they were losing those patients themselves. And so now they're able to come back in and lower that price on these out-of-pocket consumers using us as a transactional model for them. And that's really assisting the providers in reducing that bad debt, which allows them to start to bring those prices back down for the consumer.
The United States has been so different from other countries that other countries, if you go and get some services overseas, you do have more of the bundled pricing, and that's part of what you've offered up here in this discussion. How is that growing, and how do you see bundled services taking more root in the United States marketplace?
Well, I think we were the first company that I think has done this successfully. It took a lot of engineering, a lot of innovation to really get there. And when we started, we really started bundling first, and I would say the non-acute areas, things you would think about, for example, the MRI I gave you, some really minor outpatient, the primary care visits along with your lab tests, things like that. But where we're seeing the fastest growth today is about 25% of our volume is surgical. And surgical is expanding faster than anything else we do because we're just seeing as plans shift to more out-of-pocket responsibility, these surgeries are very expensive for the consumer. And so where I think it ends, and we're having these discussions with some of the payers, I think we can, by the end of this year, bundle about 75% of the entire care package of what a patient needs. The things that I think we're never going to be able to bundle in America are just some of the really high, complex acuity things, where so much goes wrong in a surgery. There's so many variables. You can't diagnose with diagnostics ahead of time what's there. So there's always going to be some of the very complex things that I think we're going to have to almost a la carte treat. But at the end of the day, I think for the employers, I think for the insurers and for the population, I think we can move to a model here rather quickly where we can bundle 70-75% of the high-volume things, and you're going to be able to really lower cost. And by doing that, we're going to reduce coding, we're going to reduce fraud and abuse on line-item billing. There's so many things that come out of bundling the procedure besides just offering the price up front.
That's great, Paul. I love what you're doing. I appreciate you spending time with us this morning. We're about out of time here. I want to give you a chance to really kind of wrap this up and leave our audience with some takeaways and how they can connect with you.
Yeah, I mean, for anyone who's out there, we have of course, a website. MDSave.com is the best place. You can come on, you can search. There's a phone number there. There's also live chat support. So if you're wanting to purchase something, you're unsure, you can easily call into our call center here. It's operated here in the United States in our offices, and they can help you walk through those first transactions or answer any questions. So, I'd encourage anyone who's got something that they're worried about paying for or some high procedures to at least take a look and use the comparative tools, even if you're not purchasing through us.
Great, Paul. Listen, enjoyed having you here. We'll talk to you again real soon. Enjoy your weekend up in Brentwood.
All right. Thank you.
Take care.